It's my pleasure to introduce Dr. Phil Mollica. Phil graduated from the University of Medicine and Dentistry in New Jersey in 1983. Prior to dental school, he received a master's degree in human anatomy at Farley Dickinson University. Dr. Mollica is an author, researcher, speaker, and currently on the IAOMT Board of Directors. He certainly doesn't need any introduction for the folks that have been around here for a while. And for the new folks that are here, and welcome, we would certainly encourage you to get to know him better, as I'm sure you would. So, my pleasure to introduce my friend Phil Mollica. There he is. Great intro, brother.
Thank you. It's always great to be in Las Vegas, ladies and gentlemen. Okay, well, I'm glad to be back on stage today. It's kind of high up on the stage here today. I'm looking out at the crowd. The crowd looks ready to go. So I have a bunch of, we're going to go over a lot of things on ozone. I'm working with my dear friend, Griffin Cole. He has some expertise. He's a brother from another mother. But he's going to be working with us today and giving you kind of a nice overview of some of the ozone therapy, the things we're doing with infective disease of the head and neck. And we'll touch a little about the basic dentistry, some of the things we're doing with as far as caries, arrestment, etc. We talked a little perio yesterday, but we're going to have some fun. I got some really kind of cool cases we'll show that I worked with other docs that we shared, and I'll present those also. So this will be a lot of fun, and maybe we'll have some time for questions before the later on question period. But what's important that during our educational programs is that really, you know, we can teach you a lot of facts, but the bottom line is really the ability to critically think about what we're doing. Thinking about, we talked about the biology yesterday, talking about biologic underpinnings. Understand the mechanisms that are producing the things we're seeing in the head, neck, and the whole body as a whole. Once again, we're but one thing. We are but one body, and a lot of things are going on in the head and neck are a reflection of the rest of the body, which happens to be connected, and vice versa. So just to give you a quick overview of what's going on with ozone and dentistry in the United States, you know, we've been having a formal educational program for about over 13 years now in oxygen ozone therapy. Our principal curriculum has really been initially designed around the general practice, the things we do daily, and we'll touch on that a little bit. The issues addressed were caries, gum disease, root canals, restorations, oral hygiene, dental equipment sanitation with the water lines. And I'll show you a couple of quick slides on that. What grows in your water lines. There used to be a great article years ago. Doctor, would you drink out of your dental unit? I don't know about that. There's something interesting grows in there. Ozone in dentistry is really utilized at this point with the number of docs we train, really worldwide, but all 50 states now have at least one or much more dentists practicing ozone therapy in their practice. And it's a formal continuing education program with the AGD, Code 162, ozone therapy. So that was a major leap forward in dentistry for ourselves. And increased number of dental specialists. And that's the interesting thing that we're seeing more and more. We're seeing specialists really come into the ozone world, especially in endodontics, where they're really having some difficulties with sodium hypochlorite. And there's a ton of literature out there now on PubMed as far as endodontics and ozone therapy, how effective ozone is as far as sanitation of the root canals themselves, and is it effective at least minimally than sodium hypochlorite and some of the interesting chemicals that we poison our patients with. Anyhow, advanced training. We started advanced training with our dentists last year. We've done a couple of advanced courses, but we really put a comprehensive curriculum together to address some of the issues that we will see today. And the American Academy of Ozone Therapy, over half the population of the academy, which is fantastic. We have information about that academy. You'll hear from the president tomorrow, Frank Schallenberg, talking about preconditioning. And everything he tells you tomorrow, believe me, I trained him in. Just want to let you know. Mention that to him. He'll get me for that. And so half the population or more actually dentists that we've trained and are interested in incorporation of oxygen ozone into their practice. So we're very happy with the progression because it's so readily utilized. What happens with our students as we train them, you don't go home, they start utilizing ozone in their practice. It becomes such an integral part. And there's many ozone users I see out here today. And it becomes you're using it all day long in a multiplicity of different disciplines that you're doing with your patients, which is pretty exciting. So How do we deal with issues like this? So this is a squamous cell carcinoma, and very infective. The thing that we do not do, I do not treat cancer. Absolutely not. My job is really to help to reduce the infective state, okay, and get better circulation. So ozone itself is a piece of the puzzle. We kind of alluded to that yesterday, but there's a multiplicity of other aspects in an integrative model that we like to incorporate into our therapies to help support this situation, not so necessarily support it, but precondition it for any possible surgical or other therapeutics a patient so desires to do. And I'm going to show you a few cases like this. And the interesting thing about this guy, and I'll show you this again, was that this guy led a healthy lifestyle. This always drives you crazy. I run, I do this, I do that, I eat organic food, and all of a sudden some beast starts growing on his tongue. And the only factor that was here was that this guy is a very well-known promoter, music teacher, voice person, Manhattan, and in our area, that he basically lived with, guess what, his cell phone on that side of his head. For hours he'd be on the cell phone. And you know what? Bizarro, I'm seeing a couple more patients like this coming along. The only thing they're doing is we're using that crazy cell phone, happen to be on that side of their head. Maybe that's a cause, maybe it's not. It's just kind of an interesting thing popping out. So it's something to really think about. How do we deal with that without this guy? Actually, he went, well, I'll tell you later the story behind him, and it's kind of interesting. So all our patients are unique, and they really deserve unique treatment. A good friend of ours, Mary Ellen Chalmers, just spoke about functional medicine. If you went to that lecture, how cool was that? That's some of the models we're building into dentistry. How beautiful is that? And part of our integrative model, we run parallel. And we love the integrated biologic dental medicine model. And of course, our patients come in different varieties. Why me? My poor son, he comes in for a nice cleaning. He actually goes to his mom, who's another, my wife's a dentist, and she does his work on him. We're working on the plastics on him, plastic surgery. So let's talk a little about getting healthy bone, because we love to put implants in. We love different things about bone. We want to support bone. So some of the ideal, biologic therapeutic goals with bone is we want to stimulation of stem cell formation, which ozone does. Cytokines, the language of bone, the language of the body, it stimulates that. We want to have a reparative osteogenesis. I'm going to show you a couple of cases where we precondition for implants, but we also save implants from failing using ozone therapy. We want to restore proper oxygen metabolism. As you know, through the infective state, our metabolic function tends to shift to a more fermentative state, which is low energy. We start to burn sugars, which is really not healthy in that acidic, anoxic environment. We want a friendly ecological environment for healing. Remember, in dentistry, which is kind of a different way of thinking, we're supporting the healing process. How can we support the patient's own innate healing processes? We want to eliminate the pathogens if that's possible, or create an ecology or an environment that's not conducive to them proliferating. Get better blood flow. This goes back to the basic concepts of osteopathy, AT still. The artery rules supreme. Well, the idea here, good oxygen in, good oxygen out, good blood flow in, good blood flow out, good lymphatics in, good lymphatics out, and supporting that matrix, that interface between that and the cells. And immune activation, getting a balanced immunologic response, and that's one of the key things that ozone does. It actually is an immunologic modulator. If you're inflamed, it brings it down. If you're not functioning right, it actually stimulates the immune system. And we'll touch on that a little bit briefly. And of course, getting the antioxidant systems within the tissues and the body itself functioning. So, can our two primary nutrients, which is oxygen and water, help support healthy bone and a healthy body? Well, let's talk about the interesting fundamental scientific facts about oxygen and ozone. These are absolutely proven scientific facts. And we take these fundamental concepts and we apply it to what we're doing to our patients. We cannot help but help them. First of all, we know oxygen ozone has great disinfection properties. Whether it's fungus, virus, bacterial, or parasitic, it will affect those and clean those. Non-toxic wound cleaning. We're cleaning wounds all the time in dentistry. Extraction sites, periodontal infections, wonderful wound cleaning effects. And improved and accelerated wound healing, and I'll show you that in an implant case. Because, once again, what retards wound healing. It's infection. We can eliminate that and make a better, once again, environment ecology in that area where you get accelerated wound healing, which is really critical in cases. We get activation of red blood cell metabolism, which improves oxygen release, that exchange at 2,3-DPG, we call it, that exchange between oxygen and carbon dioxide is much improved, okay? Activation of enzyme systems and free radical scavengers. So we're upregulating, we're doing a therapeutic oxidative burst. The body responds by upregulating those antioxidants and scavenging off those free radicals. And remember, not all free radicals are bad. As we're realizing now in immunology, etc., that free radicals do serve a purpose other than theoretically injuring ourselves. They are information highways, okay? They are information that get proper physiologic response within our body itself. We get activation of immunocompetent cells and release of cytokines. We talked about cytokines yesterday. What are cytokines? Information. Information is the key for a body to function properly. If the body is not getting the proper information, we talked about a little epithelial cell. Epithelial cells are dumb. They're kind of cool. They hang out, they cuddle, they do all kinds of cool things. But if they're not given the proper information that's transferred through that matrix itself, they're not going to function properly and go off in kind of bizarre areas. We wind up weird things growing on our tongue. So we were talking about interleukins, interferons, and really modulation of that immune system. So we get an increased capacity for antioxidants are upregulated, so we can handle oxidative stress better, and those systems are working much, much better. We call it catalase and superoxide dismutase that lie within the cell membranes themselves and the cells themselves, so they can handle oxidative stress. Once your body recognizes oxidative stress, it starts to rebound. It starts to produce much better cells that can handle oxidative stress. One of the meetings I went to in Mexico, they were having a big discussion on blood doping using ozone IVs. Because as a result of doing IVs with ozone, you're getting what they call super gifted erythrocytes that can exchange oxygen better, have greater antioxidant capacity, and you start producing more red blood cells. The body responds to those stresses. And how do you trace oxygen therapy? That's a good one to do. Has a great anti-inflammatory effect by that modulation. I'll show that in a minute. And increased circulation via nitric oxide. How fantastic is that? You inject and infuse ozone into the system, nitric oxide levels increase, opens up vascular beds, and allows supports healing. And a high redox potential. What is a high redox potential? Griff? There you don't know. There you go. High redox potential is life. It's the ability for the body to exchange electrons. Electrons gives us life. It's all about electron exchange. And ozone itself is an easy electron transfer agent. So we have a high redox potential to help healing and vitality. Well, people are new to ozone. Really, ozone is a triatomic oxygen. To make triatomic oxygen, you need an energy source. You have diatomic oxygen, which is normal oxygen we breathe. You put an energy source in, like lightning, electrical charges, corona discharges, like you see with the ozone generators. It transiently splits that double bond of oxygen and creates two singlet oxygens. Those singlet oxygens recombine with that diatomic oxygen, and once again, making just temporarily triatomic oxygen we call ozone. The beautiful thing and interesting thing about this agent, the ozone itself, is that oxygen carries an electrical charge. Now, what's interesting about that is that it carries a negative electrical charge, which works to our advantage because infection and inflammation is what? Positively charged. So you introduce ozone into the system itself, you let the ozone do the work, and you can see it spread directly into these inflammatory areas, these acidic areas, and neutralize that and create a different environment. So oxygen itself and ozone carry an electrical charge. So ozone in therapy itself, oxygen-ozone therapy. Also, just a quick note. When you load up with 1 cc of oxygen ozone, I call it oxygen ozone because over 99% of that 1 cc is what? Oxygen. Very little bit, microgram-wise, is ozone itself. Very, very, very small percentage. That's why we talk about micrograms. But oxygen-ozone therapy effectively eliminates bacteria, virus, fungus, and parasites. Well, why? Once again, we go back to normal cell membranes, okay, contain, well, phospholipids, we know about those, but they have endogenous antioxidant system, catalase, superoxide dismutase, albumin, urea, vitamin C. So healthy cells are able to handle that oxidative stress in a normal functional area. And what happens is, because they feel that oxidative stress, they actually start to function at a higher level. But the pathogenic forms themselves do not have that capacity. They do not have that capacity. They have very low, if any, antioxidant systems in their cell membranes, and that's why they are so susceptible, all of them, to oxidative stress associated with ozone therapy itself. So when ozone creates that oxidative burst, it goes into plasmatic fluids, it instantly goes into solution. So some of the techniques we showed you, like even yesterday, you inject the ozone gas, you only inject ozone gas, it instantly, light speed, goes right into solution. And two products are formed. Initially, you have reactive oxygen species, right here. And secondly, what's produced is lipid oxidative products we call LOPs. Now, where did these come from? Well, instantly ozone comes in here, creates those what's called basically hydrogen peroxides and those byproducts. The lipid oxidative products actually come from the cell membranes of the pathogenic forms. So peroxides are formed from the pathogens that we actually kill ourselves. What it's formed is called hydrohydroxy peroxides. So from the phospholipid membranes of the pathogenic forms themselves, those become peroxide, lipid peroxides. And they have a multitude of effects. They can kill further as a peroxide. They can continue that biologic cascade, that peroxide biologic cascade, with the cells further down the pathogenic forms. But also, as we found out with the research now, they're actually acting as signaling agents on multiple levels. Signaling agents also for the body to get an appropriate response. Interesting enough, these ozone peroxides are with the red blood cells. We're getting that, once again, that oxygen release, that better oxygen change through the G6PD, and also we have white blood cells, are creating little proteins within the cells themselves that actually modulate. The NFKB is a great modulator as far as immunoregulation is concerned. It balances or modulates the immune system. This is the factor that allows for inflammation to come down, or if your immune system is not functioning right, to bring it up to a balanced functional form. So we get immunologic stimulation. In addition, we have another protein that actually stimulates cellular redox potential by using glutathione and its products here, oxidizing it, creating a protein formation within the cells themselves, and we get a higher redox regulation within the cells. So we're understanding how these effects, these indirect effects from ozone itself, is working on the deep biologic level itself. Beyond just getting rid of the pathogens, we're also seeing better circulation, all the things I had discussed better. We're understanding the science in a much higher form. And we can see here, I showed this slide yesterday, but this is a case where we're seeing how ozone works. In this case, we're using just ozonated water, where we're flushing the air with ozonated water. The peroxides themselves are basically punching holes in the cells themselves, producing those lipid peroxides. And here's a fluorescence microscopic analysis showing, pathogen vitality, and just washing alone at 4 micrograms of ozonated water, they're showing the quit blighting. It's amazing how quickly light speed it works to devitalize the pathogenic forms. But the interesting thing of all this is that ozone is created endogenously within the body itself. All we're doing with ozone therapy in reality is supporting what we do naturally. White blood cells, plasma cells, and antibodies produce ozone. These studies were done at Scripps Institute a number of years ago, and they're still ongoing, because they really don't understand, how cells, the neutrophils, the macrophages, all those wonderful immunologic cells capture the bacterial forms or pathogenic forms, engulf them. I mentioned this yesterday. We always thought, well, it's got to be the lysosomes, enzyme systems. Not really. Well, they started to connect the dots where they saw where neutrophils would pack themselves with a quiescent form of vitamin C. So these cells are packing themselves with vitamin C. Then they came to realize through this pathway mechanism they were studying that the cells themselves that destroy the pinocytotic bacteria was producing ozone within the cell and punching and killing the bacterial fungal forms, whatever the case may be. So now our body is producing ozone. So here's a simple model of the bacterium being engulfed within the cell itself. Let's say it's a neutrophil or macrophage. Ozone is being produced. We have vitamin C packed in this structure itself to protect its self-preservation. Ozone packs it in, and then once they kill the pathogenic form, of course, it has to poop it out, okay? And this is where the lysosome or enzymes come in to lyse this up and allow for the soluble debris to move out. So now when you think about it, wow, we're taking fundamental elements, oxygen and water. We can do that, and all we're doing is supporting what the body does naturally, and we're incorporating into our dentistry. One of the things we learned over time is ozone medicine and dentistry, the low dose concept. More doesn't make it better, more tends to slow it down. So we want to think out of the box just a little bit. So ozone is used in a similar fashion to a drug, because we use it in a precise and calculated fashion. It's only used for a very brief period of time to, let's say, reduce the infective titer. Then we can start supporting the healing process. It induces biologic effects, and that's what we're doing. We have to think differently. We're supporting the patient's own innate healing processes. We're not overwhelming them. Let's give them tons of pharmaceuticals, overwhelm them. No, we're supporting the patient's healing process. We improve oxygen delivery. Once again, upregulating that antioxidant systems within the cells and the system itself, and getting those electrons moving around so we can support that healing process. We go back to Paracelsus. Poison is in the dose. More does not make it better. More slows things down. Less is more. So the multitude of resources in human treatment, when used at therapeutic levels, even Skittles can kill you. Okay? So in the medical dental ozone, the pharmacological effect, we have the principle of hormesis. So low concentrations, this is when we work with ozone, low concentrations has a high efficacy. Low concentrations have a high efficacy. We don't have to go ridiculous. When I started practicing with ozone years ago, we were doing 50, 80, 90 micrograms injecting each other. Man, did that burn. We survived, obviously, but you know, that was really slowing the process down. You know, with decreasing in concentrations, okay, we finally reversed into a question of leaving a toxic effect. The higher we go, we slow down the process and eventually can become toxic itself. So in the world of dentistry, our dosages really range in soft tissue. Now, what do I consider soft tissue? Well, all the soft tissue, including bone, gums, periodontium, etc. There are two exceptions: root canals and caries, which I'll show you in a couple of minutes. But our world really runs even from some 10 for soft tissue, from 6 to 10 to around 30 micrograms. So the concentrations, even in the medical end, they go up to 40 micrograms for some of the IVs that they do. So how much should we ozone use in dental therapy? We can see here internal use, 6 to 30 micrograms. That's the range. You'll get all the effects you want anymore. Certainly what's not going to help you. External use for limb bagging, some of the tricks we teach you, 40 to 60 micrograms. You don't need any more to get a better effect. The only cases where we go into the 40 to 60 microgram is we're going to stop caries, okay, arrest caries, and root canals, because root canals we love to fumigate. But we always err on the side. We lost our... Uh-oh. Thank you for coming, and I'll see you next year. Oh, well. I was just going to start doing my Elvis impersonation naked, ladies and gentlemen. Thank you. Wise men say... Oh, I'm sorry. Flashback, man. I saw Elvis twice at Madison Square Garden, Nassau Coliseum. A little tiny Elvis way down on the stage. Little Elvis. I felt bad for his comedian, this guy Jack Culhane. I don't know why I remember this name. So Jack Culhane comes, supposed to warm up for Elvis. Okay, nobody wanted to see Jack Culhane. the women are there with their bras waving, everything else. Get him off the stage. Elvis has not left the building. Anyhow, so when we do ozone, we want to go slow and low. Assess your patients, see what they're capable of, and you'll always get a positive effect with ozone, no matter what you do. Okay, so patience is a great virtue, especially more of these complex cases, which I'll show you in a few minutes. And for argument's sake, this is always a good one. How many parts per million are there? It has no significance in medicine and dentistry, but 1 microgram equals 699 parts per million. But for argument's sake, right, Bob? We'll say 700 parts per million. So anyhow, so low and slow. That's one of our mottos. So some of the things we're using ozone for is ischemic necrotic osseous lesions of the jaw, because we want to start to regenerate that area. We want to induce epithelial growth, reduce infection, get those vascular beds opened up, get that extracellular matrix going. Chronic infection, oral cavity, and associated structures. So all those things I listed before, all those things that ozone's capable of doing, we carefully try to induce into the patient, get the patient on the pathway to healing and getting better. So let's talk about some kind of fun things in dentistry. Simple things we do kind of every day before we get into the wildness of ozone. This is, I lectured for Ray Bertolotti, the guru of Bondo Kings out in California. And we're always looking for a better bonding surface. And ozone is one of those wonderful things that really create a great bonding surface. This was a study done by Jeff Knight down in Australia, showing what we typically bond onto, these surfaces. And, we think we're, chlorhexidine, all kinds of crazy stuff. But here, actually using ozonated water and then doing a little bit of ozone gas really creates and opens up these tubules and makes for a great bonding surface. And I'll show you a couple of little things in a second on that. So, some of the early studies in ozone, relationship to caries, were done in England. They were using the CAVO system and a Diagnodent as a measuring device. And sometimes with the Diagnodent, it's great, but, if you position it differently, you get different readings here. So we were looking for a kind of basically a system that we can assess what we're doing, okay, that takes the operator out. And eventually, we had Air Techniques, the Spectra system that we brought in. And I was skeptical of it, but you know what? This crazy thing works great. I mean, it's great for patient and everybody's visual today. So when you see these different colors from the blue all the way to the bright yellow, they really represent the depth of the caries on the tooth. And you know what? It really works, which surprised the heck out of me. So it's one of those things where we take our pictures and we can see, is ozone really doing, what we're talking about? So we load up our syringe, and the best way to deliver ozone to a lesion itself is to use a flowable tip. A friend of ours down in Virginia tipped us, so we used to use like inside delivery candy. He said, just put a flowable tip on. Ah, perfect. And you can get right down on the lesions themselves. So we have a case like this, which is fun. I've showed this a few times. I try to find the nastiest looking things. And you have a case like this. Well, how much more drilling should I do? With the Spectra system, we're starting to see we still have some caries. It reads the porphyrins coming off the bacteria. So here's the picture of the tooth itself. And we oxidize it with 46 micrograms per cc. And we expose it for 60 seconds, okay? So we expose it, and you start actually you see this oxidation effect on the dentin itself. And from this, we immediately got this effect. We hit it again one more time with ozone and took a picture about a minute later, and this little dot here was that, and that with another picture was totally obliterated right here. So instead of going into the dreaded root canal, which will kill you, okay, and you, I know it doesn't kill everybody, you can prevent that. And that's one of the greatest things about ozone therapy, that before you do that exposure, you have enough sound tooth structure, even though there's still caries left behind, isolate it, ozonate it, and forget it. It's like set it and forget it from Ronco, okay? And the tooth will actually heal. Teeth can heal, by the way. I know it's shocking that sound. Teeth can heal. Eliminate the infection, and you change the chemistry of the dentin. You change it from a low acidic pH. You start to elevate that pH, and what's that they're going to do? Eliminate the pathogenic forms. It will allow for remineralization occur. How does remineralization occur within a tooth? Through what? the odontoblasts themselves, those tubules, those live teeth, supporting and remineralizing the dentition itself. Here's another case of caries that this was an Eagle Scout, one of our Eagle Scouts. I wanted to kill him when he came in. I saw this big old class 5 lesion. I go, oh brother, here we go. I hate those because they just cut right across the tooth. So we cleaned it out. We got somewhat sound dentin, and we did one exposure at 46 micrograms for 60 seconds. And we took a picture with the SpectraVision, probably about every 15, 20 seconds or so. Within about a minute, a little over a minute, we had a respite of the caries. We took another picture. So this saved, and you know what? My wife's seen him a number of times, and the tooth is perfectly fine. Perfectly fine. Eliminate the infection, let the biology go, and the teeth can heal themselves. So that was a beautiful experience right there. When we do implants, we have a concept we like to do precondition bone. Preconditioning of the bone of implants themselves. We always have great technology. It's nice to place implants virtually these days. When Karen and I first placed implants back in '85, we did what was called core vents at those times. It was with Jerry Nisnik out in California, and you basically had a panoramic x-ray. You had this little overlay, and you put these little basket implants in. Well, it was great for measurements this way, but when you opened up the bone and there was nothing that way, what do we do? Oh, just cut the bone down and make it flatter. That was thrilling. So anyhow, we can see now on multiple levels and virtually place implants themselves. And we see here we can precondition the bone. Back in here, there's the area that we're going to place the implant itself in. We can go in there. Any questionable areas that you're eventually going to do implantology, consider the concept of preconditioning. We saw all the values of ozone itself. This is a X-tip here. This is an anesthetic delivery system. You put the X-tip into the bone itself, and this even applies for some of the stuff I'll show you in a few minutes for these chronic infections within the bone. Place the tip in, and then infuse ozone a couple of times, and we'll increase the vasculation, vascular area to the bone. We'll also, well, this is a root canal. This patient is doomed anyhow. So put an implant in. Who cares? They're done. And here we can infuse ozone in here and precondition the bone and make it the best safe possible bone for an implant itself. And here we're putting the implant in. And we always, and listen, any kind of surgery we do, whether it's for implants, extractions, we're incorporating ozone and ozone water and all the different aspects of ozone itself, because we have ozonated oils to apply, which I'll show you in a second. We always irrigate with ozonated water. That increases the vascular beds. You know, the thing is that not all root canals are bad, I think. Don't kill me. But in addition, the ones that are bad, we see with a 3D cone beam, we take out. If anybody takes the root canals out, sometimes that bone just doesn't bleed. It's like dead bone. You clean it up a little bit, trying to get some blood flow. Well, with ozone, even ozonated water, we teach our docs, just flow the ozonated water in there. Then within a minute or two, you'll start to see streaking in the blood. Then we actually take gas and bubble it down. It opens up those vascular beds because we're producing what? Nitric oxide. Those vascular beds start to open up because you need blood flow for proper healing. And here we're really inflating ozone down in our osteotomy itself, placing our implant in here. Now the beauty of it post-surgically, the trick is to get that epithelium to heal up as quickly as possible. And this is where 5 days post-op, we sutured that down a little bit and we applied ozonated olive oil. Any extraction site, any wound healing, you take that ozonated oil, Longevity makes little baby, we call baby jars. I tell the patients, apply it 5 times a day. I'll be happy if I get 3, but some of them are 5 times a day. It accelerates that whole healing pattern up on the implant, the soft tissue itself, and especially in extractions, because you want that to heal as quickly as possible. The retarding factor is infection. We eliminate that itself. Here's an interesting case that we received. It's always nice when friends send you cases over. That back in '09, this implant was a nice place. It's always kind of interesting how implants next to each other, one's just falling out, collapsing, and the other one is perfectly fine. We started using ozone on multiple levels, irrigation, oil placement, infusion using the inferior alveolar, our vascular beds, and we were eventually, by February of 2012, we actually had regeneration of bone up on the implant itself. Eliminate the infection, keep the environment clean. It's amazing what can be done with those implants themselves. The PERI-IMPLANTITIS. I was lecturing in Cairo a few months ago, and the big mystery is what creates PERI-IMPLANTITIS. Cement, occlusion, nobody really knows. But I was showed a number of cases where we're able to reverse that and stabilize those implants. If implants are wobbling in there, it's not going to happen. It's like, if a tooth is dead, the horse is dead, get off, you have to do a root canal. Ozone will not resurrect a tooth. And you can see the difference on the bone levels from the beginning, from April to February, which is kind of cool. Does that happen all the time? No. But you know what? I'm happy with implants that if we see them failing, we inherit them, or even sometimes our implants, of course, even though they're absolutely perfect all the time, okay? If I can stop that regression of bone, we've really provided a nice service for the patient itself. But they have to do their homework too. On everything we do, they got to do their homework. Now, yummy. Friends of mine down in South America did a study, I helped them with that, doing water and biofilm in your dental units, okay? There was a great study done by an engineering group. They found that ozonated water was the best disinfectant there could be on dental water units themselves. And this is where we talk about making ozonated water, which is a simple process to do. And those little tanks most of us have now, always adding ozonated water and running through that line. And this, this was before and after of running just ozonated water through these lines and how pristine they became. Now the beauty of adding ozonated water, other than cleaning up your units, okay, number two is that, think about it, you're doing operative, cavitroning, all that. You're using ozonated water built right into the system. So you're disinfecting and cleaning at the same time. It's a wonderful, wonderful, simple thing to do, making ozonated water and folding into your system. This was back in 2006, so it's been a while. So it's amazing how time flies when you're having fun. So at this point, I need a break. I want to introduce a dear friend of ours, past president of the Academy. And he's here. He'll be singing, what is that? He'll be singing, I love myself because I look good. Thank you, Johnny Cash.
Hey, Phil. Phil. Okay, thank you. Phil asked me to bring a case, and although this is not nearly as exciting as the osteonecrosis one that I presented, it's still an interesting case nonetheless. And I thought I was clever with the midlife lysis, but it doesn't really make sense anyway. So I get a call on a Sunday at 2 o'clock from a patient who is, actually he's a husband of a patient of mine, and he says, hey, I just had a bike wreck and my tooth has fallen out. And I'm thinking, there's no way. He's an adult, his tooth is probably broken. So I said, what does it look like? And he said, it looks like an orange cone like you'd see in a street. And I said, oh my God, that's the whole tooth. And I said, well, I'm out of town. And he said, well, what do I do? I said, you know what? Rinse it carefully underwater, put it in your mouth, and go to a dentist, within half an hour is what we were taught. And he said, that's not going to happen. I said, well, you just try your best. So he said he found a dentist that evening, so it was about 2 hours later, and I saw him the next day on Monday, and that's what he looked like. So this is about 27 hours since it was avulsed, and you can see that the dentist, he tried his best. He shoved it in. It's not all the way in, as you guys can tell. I think you can see that, right? Is this the pointer fill, this middle thing? Laser? Oh. Can you see it? I still don't see it. Where is it? It's so weak. Okay. All right, there we go. So you can see it's not shoved all the way into the socket, and you can tell by this too. It's hanging lower. It just didn't look right. So I said to him, what do you want to do? He said, well, is this not okay? I said, no, it's not all the way up. Thank you. It looks odd. I go, honestly, I can take it out and I'll re-implant it again, which I think was a stupid idea, but I thought, you know what? Why not? So I pulled it out. No anesthetic, by the way, because this guy was, as you can see, he was pretty swollen still. Took it out. I rinsed it with ozonated water. Just gently. I didn't scrub it because I thought maybe there's some kind of special attachment cells or something I don't want to lose. So I did that, and then, like in the spirit of Phil, look how low I did. 6 cc's of 28 gamma ozone gas into the socket. I'm sorry that picture's a little darker. But that's all I did. 6 cc's, I just put the syringe right in the socket. I squirted the ozone gas, and I shoved the tooth back in. And I got it all the way up, and I bonded it, and it looks nicer, so I felt pretty good about this. But of course, you know, he lost his blood supply because it was completely avulsed, so I sent him to my endodontist friend who was trained by Bob Harris. So he's an ozone trained endodontist, and this is what happened. So, by the way, I've made two mistakes already in this case. One was I splinted his teeth like you're supposed to, but you're supposed to do it no more than 7 days to 2 weeks max. I had it in there a month, so that was smart on my part. And so the endodontist sees him and says, dude, he goes, you can't have it splinted that long. I said, no, I know what I'm doing. Just finish the root canals and then you can separate my stuff. I really didn't know what I was doing. I was scared to death that I ruined this. But look already here how that's I showed you when he went there first, and already we're getting some pretty good bone fill around these root canals. Notice he did 7 as well. 7 didn't bother him at the time. There was nothing on the radiograph that indicated that, but that makes sense. If you fall down, one tooth is not going to get hurt, and that's it. The other mistake I made too, by the way, is you're supposed to get the root canal done within 7 to 10 days, and don't strap it for more than 2 weeks. So I was wrong on both cases. But this is 6 months post-op here. Looks good. In fact, 7 looks darker than 8. 8 looks really, really clean and nice. His gum tissue looks good. The bone looks really good around these root canals. So, once again, Ozone is the hero.
Yay!
Whoa.
Is that you, Griff? Okay, so let's continue on. That's pretty cool. So we need a philosophy to work around with our ozone, and we develop our integrated biologic model. And the treatment philosophy is really we partner with the patient and the dental practitioner really to develop, integrate treatment modalities that are biologic, safe, effective, established, and open to emerging therapies and technology. And really, we're not subservient to any one school of thought. So that's the beautiful model that we can integrate all different types of medicine and dentistry for our patients themselves. So when we talk about patient outcomes and goals, we really want to create homeostatic re-regulation and normalization of all the dysregulated tissues, okay? We want the patient to start healing themselves and functioning at a better level. Enhanced metabolic function at the cellular level. This will allow for normal detoxification through the extracellular matrix we spoke about yesterday and associated systems. You have to get the whole system functioning so we get the healing process. And circulatory and immune enhancement, restoration of normal oxygen metabolism, stimulation of the humoral antioxidant system, pathogenic load reduction, pain elimination, restoration of function. And most important, this all leads to the concept of healing. Thinking differently, thinking biologically, thinking in terms, how can we help our patients heal themselves? I always hit that point again and again. So we develop our protocols for these more complex cases. We talk about therapeutic architecture, design, and outcomes, and the philosophy underpinning this. So simply speaking, we want to think in a biologic manner. We talked about this a little bit yesterday, the fundamental biologic underpinnings of what's creating these situations that we're seeing with these patients. So a therapeutic design is really a non-suppressive therapy. Those are where we really run the troubles. This is where we see cortisone therapies. I mean, sometimes we need these things. We need antibiotics. Sometimes you need antibiotics. But we really don't want to suppress the patient's normal function. We want to support it in a proper fashion to normalize the function within the patient themselves. So they get to that homeostasis. Once they do that, we see healing itself. So basic fundamental architectural designs, we want principle of synergy. We want things working in the same direction. Principle anti-homotoxicology we'll touch on, principles ecobiology, and regeneration itself. So the principle of synergy, we go back to the concept of hormesis and the Berge principle. So when we're developing our remedies, okay, our homeopathies, our procaines, the things I'll talk about in a second, want everything moving along the same way, and we can synergistically work them together. Where, hormesis, a favorable biologic response, where less is more, just like homeopathy. And in Berge principle, where two different substances really join together, they give a more profound outcome with the patient themselves. So the fundamental facts, we went through that. All those things we can work through with our homeopathy, our procaines, etc., which we'll talk about in a second, and our ozone itself. So I love using procaine. Anybody use procaine here? Procaine's an amazing thing. It was usually developed, by Germany. It's a cocaine substitute, which is good. And but it really is designed as a therapeutic. I use it kind of as anesthesia also, but it is a therapeutic because it has wonderful properties and it sisters very well with ozone. Restores neurodegenerative equilibrium. Okay, neurotonicity, of course. Improves circulation. Has a regulatory effect on the cell membrane. It has an electrical potential that's the same as resting cell membrane. So it restores the functionality of cell membrane, which is the intelligence of the cell itself. Bioelectrical potential equilibrium, high redox potential, loves to donate electrons, loves to donate. It naturally has an non-toxic, and it detoxifies readily. It doesn't have to go through the liver to detoxify, okay? And it really breaks down to two products. Para-aminobenzoic acid, PABA, which is vitamin B, and ethanol, which is really a vasodilator. So we're not stressing the system at all. It's breaking down, we're giving all the supportive structure, all the support we read. Buffered, no preservatives. So we make up cocktails because, ozone's a beautiful thing, but we have to have a balanced view when we talk about biologics, okay? We want to talk about detoxification, drainage, and membrane function because we want to support all the healthy cells. This is where we put procaine with B12, folic acid, and magnesium. Magnesium is a wonderful element to fold into these cocktails to really get the circulation going because we seem to be always magnesium deficient. And using homeopathic remedies. Who uses homeopathy here? Beautiful thing. It's a beautiful thing. If you don't, use homeopathy, consider bringing it in, fold into your practice. These remedies I have listed here, we train all our docs in this. These, lymphomioside, Tramiel, and Zeal, these homeopathics are actually in the PDR. They're so effectual. They they work so well. Lymphedem from this company called Hebert is a wonderful lymphatic drainage remedy. So lymphomioside helps stimulate the immune system, but allows for detoxification and drainage. When you're killing off the pathogenic forms and getting better circulation, you have to be able to things flow out so you can get rid of it. Tramiel is what's called basically an acute homeopathic for acute inflammation. Amazing. This is always wonderful. Tramiel comes in a multiplicity of forms. You're familiar with it. Tablets, a gel, a lotion, and also injectable. Post-surgically, or if they're even a visit to the dentist, which is always fun, a couple of tablets of Tramiel underneath the patient's tongue. They have no post-operative inflammation. It's an amazing, simple remedy. And they're not allergic to it. These remedies, you cannot be allergic to it. Can you be allergic to ozone? No, it's impossible. If you're allergic to ozone, you certainly wouldn't be breathing oxygen itself. And Lymphedem, once again, is just a different form of a wonderful drainage remedy. So we combine these things to set up what we call anti-homotoxic therapy, really to support, open up that matrix so we allow everything we spoke about yesterday, getting the information and the blood flow and all the nutrients we need to the cells and also the metabolic waste out of the cells themselves. So this is one of our simple formulas that we use. We use procaine 2%. With from 3 cc's of procaine, a cc of B12, folic acid, 1 vial of lymphomioside or Lymphedem, Tramiel and or Zeal, and a little bit of magnesium. And this is how we precondition some of the things I'll be showing you in a second. So now we're developing synergistic therapies to support and enhance our outcomes with the ozone itself. And so some of these other fundamental concepts, we know about our patients. We're doing all these different therapies. They have to be well hydrated. We love enzyme therapy, okay? That helps reduce down inflammation, helps the nutritional aspects. Probiotics. Who loves probiotics? Everybody loves probiotics. Man, weed, feed, and seed your gut. That's the old mantra, weed, feed, and seed from Dr. Ali. And, because where does your immune system live? In the gut. So probiotics are creating a good flora in there. It's a symbiotic relationship. It's a fermentation cake down there. It's a zoo down in your gut. So you want to make sure you know what you're putting down there. You want to be a gardener to yourself. Get probiotics in there. Help boost the immune system and functionality. And support the gut, just like I said, because you have to poop good to look good. Remember that. And Griff looks pretty good, don't he? He looked good up here. How did it go today, right, son? Did it go? Okay. Yeah. Yeah, so like I said, I was saying yesterday, we get some people from Manhattan, and one of our first questions is, do you take a poop every day? And they said, is this a proctology department or a dentist? Well, it's part of our biologic thing. And you have people come out, oh, I go once a week. I said, I said this yesterday, excuse me, but I said, you're full of shit, man. I said, you got some problems. So we try to help them with the poopy thing, and this is where colonics come in and enemas, and you know what I mean? Yeah, you know what I mean? I told you I'd pick on you a little bit. Okay. So regenerative therapy, once again, we're helping our patients. We're thinking differently, thinking biologically. We're thinking beyond just filling a hole in a tooth. We want to support the patient. We're getting rid of the pathogens. We're changing the ecology. They're starting to immunologically upregulate. They're starting to function great. But the only way they're going to do that, number one, get some good water in them, get their gut flowing. And also, you need good nutrition. You need a good nutritionally dense diet. You need things like essential fatty acids. Essential fatty acids are critical for what? Cell membrane formation. In addition, something we don't even think about, phosphatidylcholine. What is phosphatidylcholine mixed with essential fatty acids? That's cell membrane. You're feeding your body the things you essentially what you're made up of, phosphatidylcholine and essential fatty acids. That's phospholipids, man, phospholipids to support that cell membrane. And what's important for all you great mercury removers, you should be taking trace minerals every day. It offsets that damn mercury that you're breathing in. Trace minerals are critical nutrition as part of your overall nutritional program. And I talked about this yesterday. One of the best ones I found was called Somoplex 21 from Marco Farmer. But any kind of trace minerals in your system, you should do that every single day to offset that mercury that you're being exposed to, amongst other chelating agents that you should be taking and protecting yourself with some of the things that Maddie talks about, Matt Young back there, as far as protection of our cells. So what's important on the healing process that we're talking about biology, ecology, anti-homotoxic, get the toxins out of the system, support the patient on multiple levels with some ozone tossed in this great model that we've really developed. So when we talk about treatment of the head and neck, we take all those considerations into place. So when we think about these insidious infections of the head and neck, we look at a comprehensive treatment of the head and neck. From the apex of the cranium to the base of the neck and even beyond. We think about the lymphatics, because the lymphatics are the highway for drainage, getting all the toxins out, getting all the pathogenic debris out. You have to think about the tonsils, the soft tissue itself. We utilize the neurovascular pathways to deliver ozone. How do you deliver ozone and all those other remedies? You think about the vascular supply. Go back and study your anatomy. You can always do IVs through the head and neck with ozone and those other forms, okay, if you know where to put the stuff. Treat the autonomics. One of the most important autonomics is spinopalatine, otic, and submandibular ganglia. What are they responsible? What are autonomics responsible for in the head and neck? Vascular flow, okay? Salivary flow. When the head and neck becomes very toxic, and we see these patients, those become dysregulated. They're like little dopey computers. And using Procaine and other simple techniques, neural therapy, if you're familiar with that, you can reboot those computers and have the head and neck function on a different level, physiological level, that's for sure. Take consideration of osseous structures, the mandible and the maxilla, and traditional dental infections, periodontal, chronic infected root canals. And one thing about ozone cannot eradicate a cyst. Whether a cyst is in your skin or on the tip of a root canal, ozone with cyst, it's over. Okay, when we do our 3D cone beam, we see a big root canal with a big cyst on it. That tooth is done. We recommend taking that. I don't care if you retreat it, you are not getting rid of cysts, because we've taken a lot of root canals out that have cysts on them, and we found a lot of unborn twins in there. Believe me, they're huge, these cysts that come out. Okay, and of course, utilization of ozone therapy and all the different kind of coup modalities, which we don't have time for: infusion, insufflation, irrigation, oil application, in minor and major autohemotherapy. And I think Frank Schallenberg will talk about that tomorrow. But one of the most wonderful things is minor autohemotherapy, which is for allergy elimination. Very simple technique we always teach, but that's really phenomenal as far as helping head and neck infection also. Some of the armamentarium we use is an 18 gauge needle. That's where the physicians live. We only draw up solutions with 18 gauge. Dentists are much more sophisticated with like little nice 27, 30 gauge needles. And here you can see some of the techniques that we use. We're locally delivering ozone into these areas that are cavitation-like, bad extractions in here, root canals up in this particular area, and we use the X-tip to infuse the ozone. We love edentulous areas for getting into the osteostructures. We place the X-tip and then we can infuse the ozone into these particular areas. Also, once again, we go back to our fundamental anatomy, where if you want a comprehensive effect of ozone, okay, physiologically throughout the entire system, we actually place ozone because we know absolutely scientifically oxygen ozone goes instantly in solution. We place it up right behind, like doing a superior alveolar infusion into the pterygoid plexus area. This is like doing an IV of the head and neck. Okay, this is an amazing infusion. If you want to get a comprehensive treatment of your entire head and neck, you place a couple of cc's bilaterally on the maxilla. It goes into solution. You get those peroxides flooding through everywhere. When we deal with these more complex issues, which we're folding into now, we always do this as one of our foundational therapies, always infusing in those areas with our cocktail. We wait a few minutes and we follow that with a little bit of ozone. And it is amazing preconditioning and really amazing therapy. Very simple. You guys do it every day. It's just a matter of using something different. And of course, here's my pal Bob Harris treating lymphatics. We want to make sure you take a low micro dose. Lymphatics are running under the skin. We follow the lymphatic change down. We can induce lymphatic drainage, which is very important when we start opening up these infections, the head and neck. We follow lymphatic change, put a little ozone underneath subdermally along the change in the head and neck, and that allows for great drainage, of course, in the triangular areas, subclavian and thoracic duct area itself. So we always treat those lymphatics also. And one of the greatest infected areas in the oral cavity is what? The tonsils. They are chronically infected. If you're familiar with neurotherapy, one of the major things you have to treat is tonsils. And ozone for chronic tonsillitis or infected tonsils is amazing. One infusion, maybe two the most, drains those tonsils out, and the patients are, really respond super well to that. It's always fun doing a kid with their tonsils, giving a little ozone. They hate you, but within a couple of days, that tonsil shrinks back, the airways open up. Amazing, amazing result on that. Cases like this where we're dealing with multiple chronic infection disease, we kind of call it, it used to be called Lyme, now they don't know what the hell it is, Lyme syndrome, whatever, where we're seeing patients aren't healing. This extraction when done was a number of years ago, like 6-7 years ago, wouldn't heal. Oh, I don't want my jawbone cut up, and said, well, we can have some fun with ozone. So we took 3D cone beam, we have a 3D rendering here. We started infusing ozone there, gave her a number of treatments, and we can see the difference how the bone regenerated back. You change the ecology, change the environment, change this situation here from a low pH to a higher pH, eliminate any infection, we get regeneration of the bone. And I'll show you once again the change that we made in this patient. And we also had a root canal that was fractured. We took that out, treated that, and we see nice regeneration of the bone itself. So you don't have to go into these areas themselves. Let the patient heal themselves. We got started in ozone therapy because we saw hips regenerated by a physician that we came to be friends with, Dr. Bocci in Italy. Osteomyelitis of hips degenerated. In the United States, would have lopped it off and put a new hip in. He injected ozone a number of times in the hips and they regenerated himself. This is how it all started. I said, my God, if you can regenerate a hip, we can't fix a jawbone or an infection in the head and neck? Nonsense. So this is some of the problems that we're dealing with today. This is some of the infections that I've been seeing with bisphosphonate. They call it now drug-induced, okay? Drug-induced, osteonecrosis. But these are tough infections. These are going to become super infections. You see these wounds coming up and you got to prepare because you're going to see more and more. You see the weeping of the tissue itself. This is dysregulated tissue. It's toxic. The vascular beds have collapsed. Lymphatics are not functioning right. You have a deep-seated infection. Here's what you consider epithelial tissue, but here this is that dopey tissue. You're not getting the information in. It doesn't know what the hell to do with itself. It's living in a toxic environment. It's reflecting that. We're seeing pieces of maxilla to come through. We're seeing weeping of pus coming through, pieces of bone sticking through. How do you deal with this? My oral surgeons used to say, well, just put them on Paradex forever. They can chew on dead bone. I'm like, great. Well, let's try something different. This is a case I showed a little bit yesterday. You know, classic patient. You know, he's on antibiotics for 6 months, and they wondered why his immune system didn't work. You know, if you know, it's like repeating insanity of if it doesn't work, it doesn't work. And we can see here a 3D rendering of my pal Harry here, where this is his maxilla. I mean, a totally osteonecrosis with his hunk of bone came out of his head. This is the sinus floor, and this is the alveolus. Once again, we can see another hunk of bone in his jaw here. So we started a comprehensive therapy to start re-regulation. We're using our homeopathy, our procaine, irrigation of the site, trying to open up the vascular beds. When we see wounds like this, what we try to do is take our cocktails and what we call from like human Chinese medicine, circle the dragon. We'll do local infiltration of these remedies around the wound itself. We'll follow that with ozone around the wound itself. And also think in terms of, let's say it's a maxilla, go up behind the maxilla and get some, you know, get these remedies up there to get the blood flow going to restore normalization of the tissue and support his healing process. So I can't heal this. He's got to heal it. And then eventually we're able to re-regulate his tissue and see we got it from here, where it's cleared out, able to get here, where he eventually actually was able to get a graft, so he was able to get a partial over that. So we got the tissue re-regulated nicely. Here's another case. I worked with a friend of mine, Lou Travato, which a lot of you know. For some reason, Lou digs these cases up. I don't know where they come from. Then he sends them up to me, and we share them back and forth. We lay out some treatment plans. This lady was getting a little cancer down in her tongue area here. They kept on cutting this out, cutting it out, and there was no success with this case. I says, okay. They wanted to basically take most of her tongue away. So she hooked up with Lou. Lou sent her up. We developed a treatment plan that we infuse ozone directly in and around the wound site itself. And we did this a number of times. I think it was maybe 7, 8 times. And we're able to, 7 weeks of direct infusion and indirect. Once again, we used our remedies, etc., to inject in around there. And we're able to get from this, where they just come growing back, we got it to heal up itself, and it's never come back. We're only treating the infection, not cancer, by the way. We only treat infection, not cancer itself. So we're able to do that. Here's another case where this lady had a massively infected wisdom tooth. It fistulated out through her jaw. She couldn't even get her jaw open. The oral surgeons couldn't get her jaw open because of the infection. So this is another case I worked with Lou on. We started infusing with ozone. She had this opening wound here. So within about 3 weeks, we had her open. You can see the wisdom tooth here. This thing was just wobbling around, but they couldn't even get their fingers in there. We got her cleaned up to the point, got this fissurious tract. And once again, we took this wound, we injected. I says, Lou, let's listen. Let's just inject the hell out of everything. Also considered lymphatic drainage. We did her lymphatics, got her on some good drainage remedies. Got this wound under control, and as she healed up, this was healed up pretty rapidly. They really get in there and clean that up. They just, even if they put her under anesthesia, it was amazing. They couldn't get her open until finally we cleaned her up and got her open, which was wonderful. This is another case that we were treating just the infection itself, not the cancer itself. This is a very aggressive cancer that we treated, and we reconditioned the site, eliminating the infection. And over the weeks, we saw the recession of the lesion itself, just the infected part, of course. And they actually went in there and cleaned that, finished that off. But from here, we were able to drive it back. And what was interesting with him was, like I said before, he was a pretty well known, to say the least, voice coach and all this. So it's amazing, a voice coach with this. Music teacher, etc. And he went to Sloan for this, and they said, well, we're going to take your tongue out. We're going to take 3/4 of your jaw out. So he actually literally passed out on the floor, which I guess I would too. And so somehow these, they find you, and so we work with him, and we'll see how he does over time. That's for sure. Here's another case of wound healing. This is, once again, Dr. Lou sent this gentleman up to us. He was having a problem. He had this surgery. Basically had cancer. They hollowed out the inside of his whole vault. And you can see the size of the obturator itself. And he just wouldn't heal. He had these wounds that wouldn't heal. The vascular beds were closed down. He had massive radiation to his head and neck. And so we started treating him to support, once again, that concept of the healing process itself. And you can see here, basically, the whole vault is hollowed out. We're up in the ethmoid areas here, and we can see the actual burning of the tissue from the radiation therapy. And I'll show you a little more picture of that. And this was the inside of his vault, this tissue here. This is what was presented. It just wasn't healing with that on the inside and outside. We started infusing, circling the dragon. We used our remedies, our cocktails, etc. And we were able, over a number of weeks, able to reestablish early these vascular beds, started that healing process till we actually got him to where this was, and he was okay. In addition, we worked on the outside of his head. You can see the difference here, from here, this tissue, from this burn tissue, and we were able to get this re-regulated and allowed him and supported his healing process using the fundamental concepts of we understand how ozone works and those other remedies synergistically working together. So it was kind of cool stuff. And of course, this outside wound, Lou and I injected a number of times. We shared this back and forth, able to get him healed up. And this was, Lou sent this up. This was one of the best pictures where he needed a graft, so they took it off his thigh and put it inside his cheek. So he has to shave his inside of his mouth periodically. He's alive, he's fine. Talk about a hairy tongue. Hey, whoa, check this out. Oh, God bless him. He's doing okay for himself. So some final notes and tips. I mean, when you're treatment based on an integrative biologic dental model, treat the entire patient, not just the foci. Don't get tricked out by the foci. A lot of times with these more complex patients, I won't even inject around this foci of infection for a few weeks. I just want to make sure the lymphatics are opening. We're getting the whole circulation going of the head and neck. Think of it in a broader sense. Appreciate the patient's experience, because most of them are pretty nuts at times. I can understand that. Integrate your treatments and be open to modifications. You got to change things. It's always interesting in some of these cases that we receive. I don't know, it's like a magnet. How soon can I get better? That depends on you. All I can do is help you to help yourself, and that's for sure. Understand and start to think about, what's the underpinnings of your C. Not just simply I see a lesion. What the hell's going on? Why is this happening? What's understand the patient's biologically damaged. And don't forget the autonomics of the head and neck, and take a look at those. Those simple techniques start the head functioning properly. So with the little brains, which are ganglions, start to think better and function better. And when you're doing biologic therapies, it's not like, here, take an Advil or this or that, and I'm better. They take time. It's a biologic therapy, so the patient really dictates how quickly they recover, and it takes really time to heal. And the things that we talk about at our school is really becoming dental healers. Okay, not dental mechanics. We're healers. We're helping the patients heal. It's a different mindset, and it really opens up a lot of wonderful doors. So we like to integrate ozone because of all the things that we've shown here, which are really important, the benefits of ozone itself. But one of our emotional things in New York, okay, today is September 11th, and we're just right outside Manhattan, so we really experienced a number of our patients, and it was really emotional for us a number of years ago. So I just want to take a minute, all of you, just think about those people for a minute, a little prayer, whatever way you do it, to finish off our day, and think about our fellow Americans who were struck down that day a number of years ago today. Thank you, and I hope you enjoyed the show.